Thank you, Lee. Attorney Ellen Simon is back now with some more hot topics in the workplace. There are lots of them, Ellen. Thanks for being with us today.
Thank you for having me.
You know, as a health reporter, Lee and I are always talking about genetic testing for things like recommended for women who may have a lot of breast cancer in the family to get tested for the BRCA1 or BRCA2 gene. But there is a lot of concern that women may lose their jobs or their health insurance if they are tested for this gene. But that legally, though, there are some rights now, aren't there?
Well, there has been new legislation that has been passed in Congress, and President Bush has indicated that he will sign this legislation. And the issue is that there are millions of people who are able to get tested to determine whether they are high risk for illnesses, as you said, such as breast cancer, colon cancer, emphysema, various blood disorders, and the technology is evolving, and doctors want patients to be able to get these tests, but they had a fear that they would either not be able to get health insurance, be dropped from insurance, be fired, not get hired, all sorts of repercussions involving discrimination, and that has now been addressed.
But that's not an imagined fear, Ellen.
No, that's not an imagined fear. I think that's a very legitimate fear, and there are millions and millions of people who would not participate in studies where they were asked to participate and could determine whether or not they had some predispositions because they were afraid of what would appear in their medical records, and then afraid that it would be used against them with regard to either insurance companies or their employers. That is a real fear, and in fact the studies show that many of the insurance companies and healthcare providers did indicate that they would take it into consideration. So as I said, the medical community has been very anxious to get this passed to help prevent many illnesses and deaths, and it also will reduce costs in the long run.
An important medical and legal issue there.
Yes.
Okay, another thing we've got to talk about quickly is a lot of people are getting laid off right now. The economy is very bad.
Yes.
And people always wonder, you know, am I entitled to some kind of a severance package, particularly when I lose my job through no fault of my own?
Well, it's really interesting because I just got an email about this from a cousin of mine who I haven't heard from years, but she just was laid off, and she said, I received severance, am I entitled to negotiate for some more severance? So the issue is that you don't have a right to receive a severance package. Different companies have various policies, and you may or may not be entitled, based on the company policy, to receive severance. Can you negotiate for more severance? Well, you can try to negotiate for more severance, but you don't necessarily have a right to. However, if you have a legal claim, for example, if you were discriminated against, or you can, and one should probably see a lawyer to make that legal determination because of your age or race or gender, for example, then you may be able to negotiate for additional severance rights, severance benefits, or may even have a legal claim, and probably should see a lawyer about that.
Okay, a couple of very big hot topics right now in the workplace. If you'd like some more information about either of these topics, or perhaps others you have, you'd like to contact Ellen Simon, the number to call is 216-575-1002. She's an attorney with McCarthy, Levitt, Crystal, and Liffman in Cleveland. We've also got a link to their website on Newsnet 5. Ellen, thanks so much for coming by today.
Thank you very much.